Hi, I'm Donna Badowski with the Practical Nursing Program at the College of DuPage. I'm going to be demonstrating the wet to dry dressing change that you will be performing in the return lab. The first part of the return is you need to check the physician's order for the dressing change. And so I have Brian Leggett, and there's an order here that says pack abdominal wound, BID, with normal saline wet to dry 4x4 using sterile technique. Then I also need to check patients' allergies in the chart, and there are no known allergies listed. Finally, I'm going to go into the patient's room and introduce myself and verify the patient's ID. Hi, Brian Leggett. I'm Donna Badowski with the Practical Nursing Program. I would like to first verify and see your ID band, and can you please state your name? Okay, I'm here to do a dressing change to your abdominal wound, but first I'd like for you to rate your pain for me. The patient says 5/10, and I would look to see what time the last dose of pain medication was given, and if I can give the pain medication, I would give it and wait approximately 30 to 45 minutes before doing the dressing change. However, if he states his pain is 1/10, I can proceed with the dressing change. The expected outcomes that I would want from this procedure are that the wound is healing with no evidence of infection. Next, I'm going to gather my supplies.
Okay, so I'll read those off while you show them to the camera. How about that?
Okay.
All right, sterile saline.
Sterile saline.
Sterile 4x4 gauze, 4 packages.
1, 2, 3, 4 packages of 4x4.
Sterile gloves.
I have my sterile gloves.
2 packages of cotton tip applicators.
2 packages of cotton tip applicators.
Single-use measuring device.
Single-use measuring device.
Sterile ABD pad.
ABD pad.
Tape and clean gloves.
Okay. I'm good to go. I'm going to put my chart back. And I'm going to proceed with the dressing change. I've already identified the patient, explained the procedure. I am going to provide privacy and raise the bed to my working height. Okay, I'm going to put the side rail down. I can figure out how to do this. There we go. Okay. I'm going to position the patient. I want his head a little bit lower, but I would put it to, if he can't tolerate a flat bed, I was
just showing you where the hand control was for the head of the bed, if you want that down.
I would put the head of the bed flat or to where he could tolerate it. So just a little bit low. A lot of patients can't tolerate the head completely flat. I'll just put that right there for now. Next, I am going to perform hand hygiene.
Okay, and you've taken care of the positioning of the patient. You've got a waterproof bag somewhere close in reach over there. I'm sorry the camera can't show that. Is it down below you there? Yeah.
Yes.
Okay.
I have the wastebasket.
Okay.
Noticing I'm bringing the wastebasket a little closer to me without touching because I just did perform hand hygiene. Okay.
All right, next up would be prepare sterile field.
Okay, so I want to make sure that I position my sterile field close to where I'm going to be performing the dressing change.
I guess, you know what, Donna, I didn't mention removal dressing, 1 layer at a time.
Okay.
So you probably want to do that first, I'm sorry.
All right. So I will put my non-sterile gloves on to remove the old dressing.
I'm going to come a little bit closer so I can watch you and what you're doing here.
Now I'm only going to drape the linens in his gown just to expose the area that I'll be working in.
Okay.
And I would note there's no drainage on the ABD pad, and the last dressing change was done yesterday at 9:30 in the morning.
Okay.
Okay, then I'm going to proceed with removing the tape. And then I'll remove the dressing one layer at a time. Also noting if there's any drainage on the dressings as I remove them. And I'm just throwing this in my wastebasket. And I'm ever so careful to take out this sterile dressing. Okay,
All right.
next I'm going to prepare my sterile field. First I will take off my gloves and perform hand hygiene. I would instruct the patient not to, fidget around the wound.
So you're preparing your sterile field. For anybody who's got a return demo sheet in their hand, we're at step 10 at this point.
Okay, ABD pad, which I know you guys haven't had the chance to open up, but you have to tear the top off instead of peeling it apart, like the 4x4s. And ever so carefully, I guess I'm going to put it that way. And again, you don't want to reach over your sterile field. And I'm going to try to line up my supplies as to the way I'm going to use them. That will be the last thing I use.
Okay. While you're doing that, can I ask, is there any type of a date that they need to look at on the dressings or the bottle or anything like that? Are they good to just open these things up?
Well, they should check expiration dates on the packages as well as the date and time that the sterile saline was last opened.
Okie doke.
Okay. Now I still need to open up my 2 packages of cotton applicators. I'm going to open this on the patient's bed. I'm running out of room.
Mm-hmm. I can see this requires a little bit of practice before you just come in here and try to wing it.
Definitely. Okay.
All right.
Next is
Palming the label of the sterile saline.
palming the label of the sterile saline, opening it up, and I'm going to pour it on 2 packages of 4x4. And notice I'm holding the cap in my hand upright.
Which could very easily happen.
Okay, then I'm going to put my non-sterile gloves on.
Non-sterile, okay.
So I need to measure the wound first.
Gotcha. Excuse me. I see the students are going to have to write a sample nursing note. What might be some words they could use to describe some of what they may find while you're getting ready to describe what you're going to see here?
Oh, well, that the wound bed is pink with nice granulation tissue. Edges appear to be approximating at the ends. There's no redness, swelling, or drainage noted. No foul odor coming from the wound. There is an example of a sample note on the Skin Integrity Lab PowerPoint slides. It's